Hello, I'm Dr. Thompson, Akwo, Ntuba, the Chief Editor of Health and Development Magazine, and I continue to speak to you on global health and global health. And over the years, we've been talking about global health measurements, the DALIs and the QALYs, the different rates that we use to measure global health. We talk about infectious diseases, and I work for close to 30 years on HIV/AIDS, malaria, tuberculosis. We talk about chronic diseases. We've looked at diabetes and related complications. We have talked about chronic obstructive lung diseases of COL or COPD. We have looked at cerebrovascular accidents, some commonly call them strokes, and other related chronic diseases. Cancer have been one of the major buckets that we've looked under chronic diseases. We've looked at environmental health issues related to climate change and global warming, climate change impact on the environment and on humans. And over the years, because if you appreciate that we are looking at global health improvement and equity, and then we talk about disparities. We have worked with minority communities in the United States, African Americans, Latino, Hispanics, Indian Americans, and the Pacific Islanders, the Tri-Caucus in Washington, D.C. We've worked with Congressional Black Caucus, and we've been part of the annual legislative conference, the ARC, the Congressional Hispanic Institute galas and conferences in Washington, D.C. We've been working with USA, Association of the United States Army, and the military involvement in global health. I had an opportunity to speak with Patricia Ororo, Medcom boss before she retired. We've looked at migrants and the health of migrants around the world. These global health issues, health systems, and their components of whether be the health finances, infrastructure, information, service delivery, human resources in healthcare, and all of that, all those components that make up the health system, and how in their own each way they contribute in making sure that health systems are strengthened. We've worked with the World Health Organization over many years, and we continue to do so. With the Center for Disease Control out of Atlanta, we've been part of the meetings in Atlanta. I've worked at the Texas Medical Center in Houston, and we've had travel work experiences in Europe. I've had to take an assistant who I paid travel fare to Heidelberg from Mainz or Gutenberg University. I work in France, and my travel in Toulouse, my travel to Padua in Italy, and having these discussions with colleagues in Italy, colleagues in the UK. I visit at the Buckingham Palace, at the parliamentary buildings in London, carrying my team around for violence and injuries and related work. And I want you to rest assured that programming, especially a major initiative of Health and Development Magazine and Media, is contributing greatly to this work around the world. And so we will continue to carry out conferences and workshops around the world on these issues. We'll continue to teach and be part of our media outlet, global health communication work. I am an international physician with a degree, a dual degree, which states that I have been trained in medicine and in surgery with many years of work in Africa, in a teaching hospital in Africa, in a major private hospital in Africa, directing or founding and directing a community health institution, out of which we did a lot of outreach work, uh, with partnering with governments, and out of which I went to Toulon with references from the Ministry of Health in the Cameroons on the work that we're doing on HIV/AIDS. So, with the Trump courts, I have had to speak to colleagues in New Orleans in my 8 months of work and stay in that city and county and state of Louisiana. We continue to address these inequity issues at the global scale. And we are very satisfied with the output. Very satisfied with the output. And our trainings under what I call the Thompson, Akwo, Ntuba University of TANU is basically online conference teachings. We have about 7,000 YouTube videos. We are moving a lot of those resources from place to place and putting them and putting commentaries for those of you who are actually called to global health. We are also partners and global health communication partners with the 3M, which is mobilizing medical missions done by Dr. Austin at Lakewood Church in Houston, and also the Houston Global Health Coalition and the annual conferences at the newly built and running University of Houston Medical School in the third ward in the city of Houston. We may not be in Houston every day at this moment. We are. I had ceased having residents in Houston, but that did not cease the work that we do. So we have work and operations in Houston, and we also have work and operation in New Orleans. So we are involved in Texas, in Oklahoma, where I started, especially in the area of the faith-based aspect of global health. And so we continue this work and we make sure that people get to understand why we are involved in global health and what we are doing. So at the end of the day, we do great work. We get people to be involved. We want them to participate and to contribute. We work with, like you just saw, the police people waving. So we do a lot of outreach work around the world. And as I say, in order for me to be able to give back, we continue to produce these resources that we are giving to you and showing you what is important and how to go about it. There are many of you in Cameroon, you are in Nigeria, you are in the USA, you are in Europe, and you're asking yourselves, what is global health all about? How am I going to be involved? What is expected of me? There are different aspects of global health. There are people who are involved in policy. in promotion, in prevention, protection. There are people who are involved directly in global health service delivery in the area of healing, curative practice. There are also those who are involved in global health in the area of development. So there's a relationship because global health itself can actually fit within the sustainable development goals, the number three goals, which is health and well-being. So as an international professional and expert in global health and development, if you go to our website, which is Health Consulting International, that is hosted by Wix, you will see that I am known as an international speaker and consultant, or international communicator and consultant, specialized in global health and sub-specialized in global health communication. So, like Dr. Sanjay Gupta of CNN, and an MRA professor with extensive global communication work around the world, we do the same. We do the same. But I'm not a surgeon, but I'm a trained physician. That's why you hear people say, oh, he's an international physician. Yes, I'm an international physician. And I practice medicine in the places where I'm licensed to practice, and there are multiple. But at this stage of my life, as I continue to say, I am giving back. I am giving back. And one of the ways that we are giving back is producing these teachings. Producing these teachings for you, producing these teachings for others, that they may be able to put them into good use, because global health must be distinguished from international health. Now they may be similar, but over the years and usage, the word international health is international, and international basically is an international or foreign person from overseas or all of that. So international health has always been explained or implied to mean practice, education, science, and all of that in the less developed nations of the world. And many of the times, it is always unidirectional for those who have wanted it to be that way, moving resources and personnel from the West, either it's Western Europe to Africa or less developed parts of India, Asia, South America. Now, that's not the same as global health, because I said global health is global, and